Hello, Sheila. Sheila is a patient at Hendriks Dental and came to us, I think, some 3 years ago, Sheila.
Yeah, that sounds about right.
And you came to us, and your situation was that you had a set of full upper and lower dentures, and you were having some issues with those dentures. Can you tell us a little bit about that?
Yes, they weren't uncomfortable. I wasn't in pain, but it was the retention and the problem I was having was I would use denture paste,
Yes.
which would last until I'd had one meal.
Right.
So constantly, 2 or 3 times a day, I'd be rushing to the bathroom, and obviously affected the quality of the eating, the food I could have, and my confidence really.
Did the paste work?
For a short while. If I had a warm drink, then it would start to erode the paste.
Yeah, sure.
And so in most cases it got me through.
Yeah.
I didn't starve.
Yeah. And what about socially?
Again, nobody knew that I had dentures.
Yep, sure.
So I was very happy with the quality of how they looked.
Yes.
But I wasn't as outgoing. I probably wouldn't smile as much or
Yeah.
laugh or probably wasn't as talkative. I'm not sure if that's a good thing. But
Why would they be?
because they were loose,
Sure.
and I could feel they were loose.
Yes.
Now, clearly other people wouldn't be examining me, but I lost that confidence to be
Yes.
able to just be me, really.
Sure. And you tell me you've got a job, you're in the public eye.
Well, I do sometimes have to stand up in front of other people and speak.
Yes.
Which, again, so I would definitely make sure I'd gone and put my paste in just before I knew I was due to speak. So
Absolutely.
yes, not great.
Inconvenient.
Yes.
And you probably just summed up, you didn't have the confidence in those dentures to stay put in the situations that you found yourself in life.
Absolutely.
And so you came to Hendriks Dental 3 years ago, and we talked about how we could improve the retention of your full upper and lower dentures. And you knew a little bit about mini implants.
Yes.
And we discussed the situation, and that looking at your x-rays and the amount of jaw that you had underneath the denture, that we could place mini implants probably in both upper and lower jaws. And what we did from memory, I think we started on the lower jaw, didn't we?
We did.
And we placed a number of implants there. How did you find the surgery or the post-operative period after you've had these implants placed? How did you get on?
Right, well, first of all, I wanted the lower ones doing first because they were the ones that were the least secure.
Yep. Sure.
And I'd managed with the top ones,
Yep.
and I was going to review how well the lower ones went.
Yes.
Of course, it was sore when
Yep.
the next day,
Yep.
but it's not like being ill. You know this is going to get better, and the soreness very quickly went away.
Excellent.
I had the procedure done on a Friday, and I was at work on Monday with no visible signs to anybody, and I wasn't in agony, so
Sure.
I think my recovery was pretty good.
Pretty
and
good.
I know you kept an eye on me quite closely.
Oh, absolutely.
But yeah, it was fine. So fine that it didn't put me off having the top ones done at a later stage. so that's got to be.
Yeah, that's good.
Yeah.
That's excellent. So with the post-operative recovery, any pain could be dealt with Panadine and so on and so forth.
Yes.
And you had antibiotics. Not a lot of swelling or bruising involved?
No, I don't think so. Probably my jaw ached a little bit from being open for such a long time. But as I say, nothing major at all.
Yes. And do you remember much about the procedure?
The first time I do. The second time we went for the happy stuff.
the Valium sedation.
Yes, and I would definitely recommend that. Not because of the pain, but because it was just great to come in, know that you were going to look after me, and then when it was time to go home, promised that I would have my dentures in before I was collected.
Absolutely.
And so to me, the whole experience the second time around, I would definitely recommend that because I don't remember anything about it.
Job's done, implants and dentures. I think I totally agree with you. I think that's the nicest way to do this sort of thing for people. A lot of patients just have it with local anaesthetic, but I think the Valium sedation, where you have amnesia of the event, is a very nice feature of that particular drug and that sedation facility. And I like it a lot. We do a lot of that. That's very interesting. And here we have a digital X-ray of Sheila's implants in place in both upper and lower jaws, and you can see that the Intec Mini implant basically is a screw with a little knob on the end, and those little knobs fit into metal housings with rubber O-rings in the dentures, and that's how the dentures are retained. Now we know, Sheila, from discussions before you had the implants, that quite a few things were quite awkward in terms of eating and being confident with the dentures before the implants. Now, can you please tell us a little bit of your experiences after the implants have been placed and after the healing occurred that first week? How have you found eating, laughing, talking, and so on and so forth? Could you share that with us, please?
Well, it was an immediate result. It
Yes.
wasn't something that grew over time.
Yes.
But my adaptation probably grew over time, and I'm still, even today, 3 years later, amazed at what I can pick up and eat without any concern at all. And I joke with you, I know, to say thank you, Ron, when I pick up something that's like a crusty cob. Something as simple as having a crusty cob.
Yeah.
So that's how much it changed my life. I enjoy my food.
Yeah.
Afraid I put a bit of weight on, but hey.
You look fabulous. You look fabulous.
That's yeah. I can't really tell anybody enough what a change in my life it's made.
Yes.
Food tastes better.
Yeah.
Because I know I can enjoy it. I can eat nuts. I can eat naughty, chewy chocolate bars, and yeah, so just fantastic. But